So it's noon. Welcome everyone to our another series of Lunch and Learn, this time dedicated to functional medicine. I would like to welcome Brooke Sides. And ever since I know Brooke, or I met Brooke, she's constantly taking classes, getting more degrees and certificates because as a in field of healthcare, which is so evolving so fast, and new things are being discovered, and so she's like really great in in believing in continuing education, and she's one of the few people I know in Kansas City who is certified in functional medicine. She's also a licensed professional counselor, and today she's going to talk on the latest topic of functional medicine. So welcome, Brooke.
Thank you. It's always fun to do these classes, so thanks for having me. Before I get started, since I know some of you are leaving earlier, I'm putting in the chat box my name, and I know a few of you are here because you're on my email list. So if any of you are not and you want to be notified of upcoming talks and events, there's a link there where you can sign up on the email list. You also get a free guide for, it's got like 5 things that help with anxiety and can help promote calm and sleep. So that's there if you would like it. And we'll jump in. Oh, the second thing I wanted to say here at the beginning is that if you have questions, feel free to put them in the chat box. If I don't see them right away, I'll make sure, Magda and I are going to make sure we check it about halfway through and answer those before some of you leave early. And then we'll check it again at the end and have some time for Q&A at the end. So this class is really to dig in on what functional medicine is. There have been some studies looking at how effective is functional medicine. And interestingly, there's like the highest percentage answer is we don't know what it is. There's a lot of people that don't know what it is, or that there is some evidence, which I'm going to share with you today, that is now being done, more studies being done on the effectiveness of functional medicine. But for a while, there weren't any big studies on it. And so people didn't really know about it, and it wasn't in some of the bigger healthcare facilities. Now that there's more, and there's a clinic at the Cleveland Clinic, it's becoming better known, and there's more trained practitioners popping up. And there's a couple places. I'm happy to give any referrals or info for people in town. There's practitioners around now, of different types of licensures, which we're going to talk about today. Like, how do you choose the right practitioner, and what sort of license are you looking for? And then we'll talk about how this differs from conventional care and other types of healthcare also, because there's a lot of names that get thrown around: integrative, functional, homeopathic, naturopathic, and what does that all mean? And how do you decide what you're looking for? I always like to start and share how I came to functional medicine, because I was an actress and my undergrad degree was in musical theater. So what led me into going back to school for nutrition, and then getting certified in functional medicine, and then becoming a counselor. And a lot of it was my own wellness journey. The first bite of food my mom gave me was plain yogurt, and it sent me to the hospital as an infant. And the doctor said that I would have a lot of allergies growing up, and he was right. I remember as a kid just breaking out in hives all the time, and Benadryl was my best friend, and nobody really knew what to do about that. I didn't eat dairy because we knew that was a problem, but we didn't really understand why I seemed to react to like lots of things, and it would change over time. Like, I'd eat a bagel with some seeds on it and break out in hives, and then the same thing would not do that, a year later. So there seemed to be these like revolving allergies and immune reactions I was dealing with. And then that progressed as I got into like adolescence. I started having obvious gut problems, like lots of bloating and abdominal pain. Then the next symptom that showed up was anxiety. And so I started dealing with anxiety. And I think also there was an interesting nervous system component with that first bite of food causing me to go to the hospital and having a big reaction. I had a really bad relationship with food. I felt like everything I ate was going to cause a reaction. I didn't know what to eat. So then I started restricting eating and had disordered eating patterns for quite a while. And it was, I think late college or right after that, that I realized I was living in, it was right after college. I was living in New York. I went to an audition and I felt like my heart was racing. So this new thing came up where I just seemed to have anxiety, but it felt like it was in my body. Felt like my heart would just race and I couldn't seem to calm my system down. And I remember just not being able to sing very well and really just bombing this audition and getting on the train, subway to go home and crying. And I felt like my body was just running away from me. And I had all these symptoms and I didn't understand what was going on or how I could fix it because every time I went to the doctor, I was fine. You know, they do labs, it checked out. I went to a little bit of counseling, which helped, but it seemed like whatever was happening in my body was not, there was nothing wrong with me, but it felt like there was a lot wrong with me. And so I went online and I looked around and I found a nutritionist who said that she did functional nutrition and that she worked on things like gut problems that could cause anxiety. And that seemed to click for me. So I went to her and that was kind of my first step into working on my gut health. And I couldn't believe that in just doing a few things like I changed my diet quite a bit. I changed what I was eating. And then we did some gut work. And it was 30 to 60 days later, I noticed a significant decrease in this heart racing anxiety feeling in my body. Everything just seemed to calm down. And that was pretty powerful to me, that I still to this day, if my gut is getting a little out of whack, that's what shows up for me is either fatigue or kind of this like body anxiety that calms right down as soon as I get on top of my gut health. And so that to me was really powerful, this connection between the gut and the brain and how impactful it is for mental health. And so that led me down a path. Eventually, I went through years of performing, but I eventually went back when I decided to start a family and went back to school for nutrition. And then, you know, have continued to learn in part for myself and also for my kids and for clients. And through the years, I was referring so much to counselors because I think we're going to talk about this with functional medicine, but I was drawn to functional medicine because it looks at the whole person, not just what's happening in the body, but what's happening around our body, what's happening in our thoughts, what's happening with our movement and our exercise, with our relationships. And so I was drawn to counseling and eventually went back to school for that. So kind of incorporate those together now. So defining conventional medicine, it is a system in which medical doctors and other healthcare professionals, so nurses, pharmacists, therapists, lots of other providers, largely treat symptoms and diseases using drugs, radiation, or surgery. And this is always important to really understand what conventional medicine is, because I think for many people, it is medicine. It's all there is, right? Many people don't know that there's integrative options or functional options or naturopathic options. And so they go to the doctor, get the checkup. This is what's covered by insurance. So it's where most people are going to go, you know, if they have an insurance plan to be seen. And the toolbox, what is largely the toolbox for treatment are drugs. So if there's not a drug, there's not going to be a diagnosis. If there's not a surgery, there's no diagnosis, right? So some people will say to me, like, why, when I got my functional lab work, were there all these things to work on? But my regular doctor says I'm fine. And I always explain, like, you're talking about two different types of healthcare. So one is looking for disease, and not by any means throwing conventional medicine under the bus, because we can do amazing things, right? Conventional medicine is really wonderful for acute disease and illness. I would be dead if not for conventional medicine, because when I was in the 3rd grade, I got chickenpox. And I recovered, went back to school. And that Friday I went to school and I had a little boil on my leg. And throughout the day, it turned into this big, ate into my muscle. And it was a strep infection in the muscle of my leg that put me on antibiotics for 3 days. Probably that wouldn't have been treatable without antibiotics. So although antibiotics have caused a lot of problems and they get overused, they've also saved lives, right? And so conventional medicine, I think one takeaway I definitely want to share in this class is that it has a place. We have places for these things, but unfortunately we're trying to use conventional medicine to treat chronic disease, which is usually a lifestyle-based problem. And so using drugs to treat a symptom when there are root causes that come from our diet and our lifestyle and our stress, isn't really getting to the root of the problem. And so conventional medicine, really great for acute issues, for accidents, right? If we get in an accident, we need surgery, things like prosthetic limbs, helping with disabilities, a lot of wonderful things that can be done through conventional medicine. It's also called allopathic medicine, biomedicine, mainstream medicine, orthodox medicine, or Western medicine. So those are other terms you might see for that. Functional medicine, it addresses the underlying cause of the disease. And in functional medicine, we're taught a systems-based approach to identifying and addressing the root cause. And so functional medicine tends to be best done for a period of time. So that's why you will see a lot of practitioners that do a 6-month program, or ask their patients to commit for a certain amount of time, is because you're going to start by looking at diet and lifestyle. You're going to test and see what's going on with micronutrients, with gut health, with detox pathways in the body, maybe a little bit with genetic mutations, with toxic burden in the body, hormones. And so we, in a functional medicine training, practitioners will go through learning about each of these areas. And then there's kind of an order typically in which we work on those. Gut health is one of the first ones because the gut is the root of a lot of these other things. Sometimes we work on gut health and then the hormones just naturally get better, or we don't have as much toxic burden because we're eliminating well, we're absorbing our nutrients better, so the micronutrient panel looks better. But it is taught and usually utilized in kind of a systems-based way. Different practitioners will use this differently in practice, and I'll get to that. But that's the overall view of functional medicine. The other difference is that in allopathic medicine, there's typically an expert-patient relationship. The doctor's the expert, the patient is the patient, and the expert kind of lays out the prescription, and the patient there's not a lot of time for questions, and you take it and you go and you do it. And in functional medicine, it's supposed to be a partnership. So there shouldn't be an expert-patient relationship. It's a partnership. I always, personally will tell clients that, like, I'm going to do the process I've been taught and use my best skills to identify what we need to work on and lay out a plan, but that ultimately, then I want to hear, what do you think about the plan? How do you feel? Does this work? Does it not? And then we adjust it together. And so it should be more of a therapeutic partnership environment. So here's some other ones. So functional medicine, and I will say all of these names kind of get thrown around, and it gets really confusing, I think, for consumers to know, oh, this person says that they're a functional doctor or an integrative doctor, and what does all this mean? Functional medicine is a specific certification. And so I've seen sometimes the title being used when that person or practitioner isn't trained in it, and they're kind of doing some root cause medicine. So I think what they mean by the title is I'm doing more root cause medicine, but they might not be trained in the system of functional medicine. And so that's one thing to ask if you're going to a provider, is what training they've been through. And I'll talk about some of the training programs out there, because I end up seeing this happen where I'll have people come to me, or I'll be talking with them, and it's like they've done one part of the system, but they didn't really there wasn't the whole picture looked at. So it makes me think there's probably some practitioners out there that have been trained in a piece of it maybe, but don't quite have it all put together. So that's something to ask as you're looking for a provider. Complementary medicine is basically just means unconventional treatment that's used in addition to treatments by a doctor. So if there's complementary medicine, it's kind of added on to more of an allopathic approach. So they might have, and that could be as something like that doctor, is trained in meditation, and they prescribe meditation to their patients along with the other allopathic treatment. Alternative medicine is usually used in place of traditional medicine. So if that term's being used appropriately by that provider, then they would be really more of an alternative provider trained. And then you'd want to ask, what sort of alternative treatments do you use? What are you trained in alternatively that informs your approach? Integrative medicine combines practices and treatments from alternative and conventional. So a functional medicine provider could call themselves an alternative medicine provider, right? It's an alternative type of care. Integrative could also be functional medicine, or it could be some other sort of alternative care that's being integrated in with that conventional approach. And if it's an integrative provider, you're looking at like a licensed nurse, nurse practitioner, a physician, MDDO, because they're trained in conventional approaches and they have training in an alternative type of medicine. Naturopathic medicine is a distinct system of primary care that emphasizes prevention and self-healing using natural therapies. Naturopaths, if they're a licensed naturopath, are very, very well-trained people. They go through medical school, basically, and so they have a lot of knowledge of disease and disease processes in the body, but their treatment is all herbs, nutrition, lifestyle, and homeopathy. Some of them do hands-on type of, some of them are trained in acupuncture or massage. Some do, I've met some naturopaths who do like somatic experiencing or more counseling type approaches. So it just depends. There's there's naturopaths that are also trained in midwifery. So that would be ND is that title. There is a big practice here, which is wonderful, of NDs. It's called Kansas City Integrative Health, I believe. kcnaturopathic.com is their website. They, Dr. Laura Roos started that practice. It's a really great practice, and it feels just like you're going to the doctor. You get checked in, you get weighed by the nurse, blood pressure taken, all of that, and then you go see your naturopath. And the first visit's an hour, follow-ups are sometimes 30 minutes. And so that's a great option too. And we can talk about like, how do you pick the right provider for you? So we'll get into that. But naturopaths have some degree, I would say, of some of the medical knowledge, but they don't, and it's state to state if they prescribe pharmaceuticals. In Kansas and Missouri, they don't have prescription rights, I don't believe, but like in Washington, they do. So they are good providers. They're definitely on the alternative side, but they will know a little more about maybe what your allopathic doctor is saying, and anything they're recommending to be able to help navigate that a bit to some degree. I mean, there's some things they're able to do and some they're not, depending on the state. Homeopathic medicine is a totally different system of medical practice that treats a disease using doses of a remedy that would cause the same symptom that's happening. So homeopathic medicine is more symptom treatment. There is a lot of training that goes into being a homeopathic physician, but it's a very specific array of remedies that are used. And the idea is that like treats like. So they would pull up a couple of things I was going to share on that. Like cures like. It originates from Egypt and ancient Greece. And it's this idea that when a substance in large doses causes certain symptoms, in small doses, it can cure these same symptoms. So you get these remedies that are super duper duper diluted that would cause the same symptom that's happening in that person. They're taken from herbs and other plants typically. And as I said, like highly, highly diluted. And then there's like different dilutions that treat different issues. Acute or more chronic is one of them. I was looking for scientific evidence on homeopathy because I get this question a lot. There's more I could dig into on that, but in some clinical trials, homeopathy wasn't better than placebo, but in other studies, researchers believe they saw benefits. And I see a lot of there's allopathic physicians prescribing, like a lot of surgeons prescribe arnica. Anybody used arnica? Yeah, me too. So arnica is for bruises, and that seems to be one that's prescribed a lot by allopathic physicians. Then there's some others that a lot of people haven't heard of. So there's a whole array of those. Naturopaths are trained in homeopathy and they sometimes use them. And then a homeopathic physician is just using homeopathy. They might prescribe some diet and lifestyle also. Holistic medicine just means treating the whole person. So if somebody says they're holistic, they just mean they're looking at mind, body together And again, you would want to just ask what that means for them, what kind of training they have, what their approach is. Feel free to put in the chat box if you've seen any other um, names of things that you're confused about, or if that kind of helps clear up some of those titles. I will say that I think those titles are just sort of used a little bit willy-nilly. You kind of have to just ask the provider what their approach is or how they're trained or what they do, because they're all used somewhat interchangeably, except for naturopath and homeopathic. Those are pretty specific. Whoops, go back there. RDN is RDN, registered dietitian, I think, but so RD is registered dietitian. RDN, I am not 100% sure. Does anybody know what that license would be? It sounds like nursing or, oh, registered dietitian nutritionist, probably, RDN. I think that's what that is. So hopefully that answers it. Lisa Markey, is that what you're saying, Lisa, that she's an RDN? Markley. Okay, I'll double check, but I think it's a registered dietitian. Yep. It's a registered dietitian nutritionist. So I believe that means that there's some more integrative and holistic nutrition that person has been trained in. Because dietetics is typically really goes on the conventional allopathic side. So that training, the diet, the food plans are very different in dietetics than they are in holistic nutrition and in functional nutrition. So I think RDN is integrative, an integrative nutrition provider. So we talked a little bit about symptom versus root cause. Sometimes I explain what this means, just so that everybody understands. So signs are something that, if you see someone, you can see that they're, bags under their eyes, or they have a rash on their face, like all the signs that you see on their body would be observed. Symptoms are the things that we feel, that we tell our provider, I feel really tired all the time, my stomach hurts, I don't sleep well, I keep waking up at 4 a.m. and I can't get back to bed. Those are the symptoms. And so when we talk about symptom treatment, we're talking about like, okay, if I'm waking up at 4 a.m., what makes me sleep? Well, a sleeping pill could make me sleep. That could be a pharmaceutical. Could be melatonin, although I wouldn't use melatonin for that, but you get my point. It could be on the alternative side. So it could be phosphatidylserine might be something I would use for that. That would be a symptom treatment. So we're not really looking for the root of why we're waking up. We're just doing something to help that not happen. If it's, a rash, we're using like a corticosteroid cream to calm that rash down. And root cause would be, why is that rash happening? Is it something we're eating? Is it something going on in the gut with the microbiome? What's happening? And so if we're working clinically, we would go in and test for some things and see what we find. If we're working, and if we're not working clinically, if we're not getting labs, then we can make some educated guesses about what those root causes are and kind of see if we can work on those things. In functional medicine, typically we test and we don't guess, but I know that I know in my practice that there's a budget that most of us are working with, and testing can be expensive. So I work with some people, without that. We just kind of do our best and work with trying to work on the root cause with educated guesses about what that might be. So symptom treatment happens in all kinds of care versus root cause, right? Symptom treatment definitely happens in conventional allopathic medicine. It happens in homeopathic. That's kind of how that approach works. It happens in naturopathic sometimes. There's some naturopaths that don't do as much testing, or it's always, I think across the board, it's used a little bit at first because everybody wants to feel better fast. So, there's things we can take and say, hey, does this kind of take the edge off? And so, but you can certainly go to a naturopathic physician, and it may be someone who is doing more symptom management, right? They have people coming in, they're seeing more, maybe the setting that they're in, and they're kind of, using melatonin so someone can get to sleep, and using, I don't know, ginseng in the morning so they can feel awake. And so it's more kind of symptom, but it's much gentler approach. And it may be what we need for the root cause too, if the problem is adrenal and circadian rhythm disruption, right? Integrative sometimes uses some symptom treatment. Root cause treatment happens in functional medicine and typically in naturopathic medicine. That training is more to get to the root of what's going on. And so that will usually happen in a naturopathic medicine situation also. So here's the lovely functional medicine tree. And I know some of this is probably kind of small on the slides, but if we look up in the branches of the tree, we see, all these different areas of medicine, right? Or different systems in the body. Got urology, pathology, immunology, cardiology, endocrinology, gastroenterology. And what can be difficult about looking at symptoms to treat disease is that we're going to different offices for different things, and those providers may or may not be talking, right? And so we're getting like different treatments for these different areas up in the branches of our health, up in the symptoms. When if we go down to the root cause, this happens a lot in functional medicine. It's super cool. I've seen this happen where somebody comes in for a 6-month program and they get a whole bunch of labs. We get a whole bunch of information. And sometimes we need that and it's really great. But I've also seen it happen, and I've worked at other places and really good providers, but also these like longer programs. And we get all this stuff and we change their diet. So down here at the bottom, do you see in the roots, nutrition, hydration, and then, yep, nutrition and hydration. So we just do that. And I find this is made up statistics. It's not accurate, but it feels like somewhere around 50% of people, there's a big bulk of the people that show up for functional medicine that will get better just from nutrition and lifestyle and hydration, right? We just get to drinking water, we change diet, we work on lifestyle approaches and exercise. We do some of those things that cost a little bit, maybe maybe we're replenishing some nutrients in supplemental form, but then mostly we're just working on eating healthy and exercising. And half of those people, it's like 80% better. They come back and they go, I really thought something was wrong with me. I had severe anxiety and all these things were happening, and they're really a lot better. And then there's the other half or so of people who they do those things and they feel better, but it doesn't really seem to get to the full root of what's going on. And there may be issues with their hormones or with their microbiome or some of those other areas I talked about that we look at usually in functional medicine testing. And once we work on that, then once we're able to target those areas, then we start to see improvement. And then sometimes there's 10 to 20% of people that it's a little complicated. I saw someone put in the chat box like mold and fungus. So sometimes we have an environmental issue, like there's mold in the home, or there's, and that person might have mold mycotoxin illness, or there's Lyme that's not been found, or a lot of toxicity, toxic burden. So there may be, sometimes more going on. But that's why we have down here at the roots all these areas to explore. And I've also seen it happen that trauma is like the big root cause, and so when we start working on nervous system regulation and processing trauma, that really starts to improve things. And so we've got all those roots. Those play into our genetic predisposition. I remember when I was in school, in nutrition school, there were 2 people in the class and we were going over, if any of you have ever had like your genetic mutations sorted out, there's something called MTHFR, which is a relatively high percentage of people have this mutation called MTHFR, which causes folic acid, which is in a lot of breads and cereals and things like that. And it's an essential nutrient to have folate, but it causes them not to absorb and utilize folate very well. And if that's the case, it can cause things like anxiety, reproductive issues like infertility or miscarriages, cardiac or cardiovascular problems. can kind of cause a bunch of issues. And so these two people, we looked at their genetics and they both were homozygous for MTHFR, two of the different mutations. They both had the same things. And one of them had grown up in a home where she had healthy foods, two kids, two parents that were ever present, you know, and had a really, what she would describe as a really wonderful childhood. And the other person was like the eighth kid of 9 and had a lot of trauma in her childhood. And so we see here right above the roots that there's that genetic predisposition, and then we have antecedents, triggers, and mediators. And if there's trauma down there, then that might cause those genetics to express more and cause problems up in the branches, right? And produce a bunch of symptoms later. And she had had multiple miscarriages and a lot of issues. And so as she was learning about all of this, it helped to kind of explain what was going on. And you can see in the trunk, we've got assimilation. We work on digestion, absorption, the microbiota, the GI health, and repair. We work on immune system, inflammatory processes, looking for infection and working on that. Energy, so we look at mitochondrial health. There's actually a nutrition plan in the Institute for Functional Medicine called the mitochondrial plan, which is kind of a funny name because it's a little long for a food plan, but it's basically helping to improve cellular energy. There's hormones and neurotransmitters, how we're transporting our structural integrity. So all of that's kind of, and I can send this out if anybody wants it, this handout on the functional medicine tree. But it kind of explains how up at the top in conventional care, we're mostly just looking at those branches and we're treating the branches. And in more root cause medicine approaches, we're looking at the roots and we're addressing and treating the roots of the tree and seeing what happens with the branches. And a lot of times multiple branches get better when we get to the root. We don't have to go in so many different directions. So then the question gets asked, and I mentioned this earlier, is functional medicine evidence-based? And I just realized it's 12:30, so I'm going to peek really quick at the chat box. Oh yeah, registered dietitian and nutritionist. Would 23andMe catch that mutation? So what you do, if you have your 23andMe data, you have to put it through another sort of software that would give you the genetic mutations and explain them. I think you can look at it from the 23andMe data, but you pretty much have to be a geneticist to like understand the raw data and what that all means. And so one resource is Stratagene. I'll put that in the chat box. Stratagene. And that is Ben Lynch's. If you're interested in genetic mutation info, Ben Lynch is kind of the leader on this. So I put his name. Seeking Health, I think is, I don't know if his websites, it might just be benlynch.com, but if you look him up, you'll find Ben Lynch and Stratagene. And if he used to have it where you could upload data from any of these places into Stratagene, and it was like $45, I think, to do that. Now you might need to get the genetics through him. And so if that's the case, there may be some others, but I would have to look back at some notes. So I'd just say reach out to me directly and I can look that up if you're trying to do that. Okay, back to here. So a little bit of info on this. I mentioned the Cleveland Clinic Clinic opened a functional medicine center. Dr. Mark Hyman, anybody here follow Dr. Mark Hyman? Yeah. What the Heck Should We Eat? That book. And he's got a new one now, I think. I think it's called The Pegan Diet. Yeah, lots of people like Mark Hyman. He's kind of my favorite for just taking really good nutrition evidence and like putting it together, you know, and explaining it. So he founded the functional medicine clinic at the Cleveland Clinic, and it's one of the first functional medicine practices to exist within an academic medical center. And the main goal was to help transform healthcare. They wanted to shift traditional disease-centered focus to a more patient-centered approach and also start researching and getting some evidence on the approach of functional medicine. One of the challenges with studying functional medicine is that I wrote some notes on this so I would explain it well, but basically when we do research, a lot of double-blind placebo-controlled studies are much better at studying a specific intervention, like a drug, or maybe a single herb. They're not so good at studying a system approach to something. And so that's been a bit of an issue with studying functional medicine, but now they're getting some more studies. There have been a couple done, there's some more on the way, looking at like what happens when people go through a 10-week functional medicine program, what sort of outcomes do they get versus the conventional approach. The first study was published in 2019, and it demonstrated global improvements in patient-reported health-related quality of life outcomes in patients that were treated with functional medicine compared to those treated in a family care clinic. And then in 2020, they came out with another study that was looking at inflammatory arthritis patients that were treated with functional medicine and showed improvement in all primary outcomes compared to standard of care, so compared to allopathic approaches. And now there's a new study that was published in BMJ, and they are looking at, there's been more of a push for functional medicine-based shared medical appointments. And so I don't know if any of you have heard of, like, there's a couple of functional medicine providers over at College Park Family Care. One of them who I know better is Jeff Evilsizer. He's a physician's assistant. I know a year or so ago, he was asking me about, what I'd seen or thought about the shared medical appointment model. And they were thinking about doing that because let's say you have 10 people who are trying to get appointments for diabetes, which is a common diagnosis, right? And you're trying to spend an hour with them, and then there's maybe an hour with the nutritionist, and there's an hour with a health coach, and they're trying to, implement nutrition and lifestyle changes, which takes a lot of education and time. That if you can just put these people together and do a shared medical appointment and say, hey, here's your labs, everybody there's some confidentiality stuff there. Everybody has to sign off that it's okay to hear each other's private health info. But you sit down and go through the labs with everybody and explain them all at once. And they're holding their individual labs and understanding what that means. And then you're in a shared nutrition visit, learning about the food plan for diabetes and kind of individualizing that this would be a way to get more people in, reduce the cost for the patient or the client, and allow the doctor to have time or the provider to have time to see more people. So there's some places starting to try to implement that. And the Institute for Functional Medicine is working on studying that, putting out more information about shared medical visits. So that's something that hopefully might start showing up more in the future. So primary causes of disease in functional medicine, these are some of the things seen as primary causes of disease. Toxins, whether that's synthetic, biologic, or elemental, allergens from food, mold, dust, animal products, pollens, chemicals, microbes, any of those things that we'd look for in a comprehensive stool analysis that could, cause issues. We actually, this is completely anecdotal, and I don't know for sure, if one thing caused the other, but this would be something in functional medicine we would wonder about, is that my now 5-year-old, she just turned 5 in March, she had her first asthmatic reaction. We're having some allergic asthma going on, and it's new. And it started last fall when I was having trouble getting lice out of our house. She had lice, and I could see red dots on her head where it was irritating her. And she's got obvious allergies, but I think she's allergic to lice. And a couple of people noticed, like, wow, and she seems to that. We'd never had lice, and then we had it like 2 or 3 times through the fall. And every time she had it, she was like reacting more. So in functional medicine, we would wonder too, what allergens can we take away from being around this body or on this body to help symptoms calm down? Microbes can also include like small intestinal bacterial overgrowth or other types of pathogenic bacteria in the gut or viruses, parasites, ticks, stress, physical and psychological. And my main counseling approach is called somatic experiencing, which is largely a trauma therapy, and it's working on the nervous system and with the nervous system. And the reason that I found that is that because I love gut health, right? And we have to digest, we need to be in the parasympathetic nervous system, which is our place where we rest and digest. And if we're stuck up in sympathetic activation all the time, which would be kind of fight or flight all the time, we're not really, we can kind of work on the gut, but we're just going to go in circles, right? We've got to kind of work on being able to deactivate in the system. And what's interesting to me is that, and I was one of them, so I'm talking about myself too, years back. I will ask people sometimes how much, on a scale of 1 to 10, where's your stress these days? Like 10 being high, 1 being low. And people will say, pretty low, I think. But then when we start talking about how they feel in their body or what's happening, from the neck down, it might not be like mental emotional stress, but the body has is maybe co-regulated as a child to being really activated all the time. We co-regulate to our caregivers. And so sometimes there's almost like a, what's the word I'm looking for? Generational trauma, that we may not even realize that's just in our system from things that happened with our caregivers or our parents, or maybe, other things that we sort of absorbed through time. And it's now how we operate in our system. And so that can make a big difference. So when I say stress, I always think of that as not just like mental, emotional stress, but stress in the body, nervous system dysregulation. And then poor diet, eating a standard American diet, not getting the things that we need. Things we need to thrive are proteins, fats, carbohydrates, fiber, nutrients, right? Lots of phytonutrients from the rainbow of vegetables, vitamins, minerals, phytonutrients. Phytonutrients are what we get along with vitamins and minerals from the rainbow of produce. Light, water, air, fresh water, sunlight, movement, exercise, rhythm, music, maybe, love, community, connection. The last 2 years, we lost a lot of people, didn't have connection, right? And there's studies on social isolation, and somebody give me the exact statistic if you know it, because I don't remember it, but there was a study that looked at social isolation, and I don't remember for how long or like all the measurements of this, but it was showing that is equivalent to smoking so many cigarettes a day in reducing health quality, which was pretty amazing, but not surprising, right? Our nervous systems were actually, we to survive, we need community. We need the people around us. We need to know what role we play and how we fit in and who we can rely on. And so not having that or feeling isolated can be really detrimental to health. And then meaning and purpose. And that can be kind of psycho-spiritual, lots of areas there that can lead to, that is an important area of health. My chat boxes. Okay. Primary causes of disease. We kind of went through that already. So that's a little bit of a repeat there. And then things that promote optimal health that I didn't mention would also be a healthy environment. So relationships in our life, people around us who we live with, a positive environment can be a pretty important thing. Having negative relationships or negative environment, criticism, things like that can be really detrimental. And so environment really looks at like our workplace. I remember a friend of mine was seeing a naturopath, and it was someone I'd referred her to. And she said, well, we did some stuff, but the naturopath at the end of the appointment told me that we can do these things, but she's not sure that I'm going to get better if I don't find a new job. And I was like, good for her, because I was her friend and I knew that her job was really reducing her quality of life and making her very unhappy. And some of her symptoms were probably due to that, not just what she was eating or exercise or anything like that. I include play here because from being a theater person, I was kind of a workaholic but my job was play, right? I played all the time. From the time I was little, I did theater up until I was about 28, 29 when I went back to school for nutrition. And when I went back to school, I was still a workaholic and I forgot to play. So there was a number of years that I would have this experience where I'd go stay up a little later than usual, hang out with friends, laugh, maybe have a glass of wine. And the next day I would feel amazing. I was like, what is going on? I do yoga, I eat well, I do all this stuff. So why is it that I feel better and more energized after these nights where it's like I'm doing all the things that aren't supposed to be healthy? And it was because I was playing and I would hang out with people that did sing. So I'd sing with them or, have a little jam session and I'd always feel better. So that triggered me to realize I needed to get back to what is my play. And for me, it's singing. So I still get out and sing once, a couple times a month. And I always feel really relaxed and energized the next day. This is just a list if you run across any of these. I'm not going to go into them each, but the Institute for Functional Medicine has a whole bunch of food plans and they train providers on when and how to use each food plan depending on what shows up in people's labs and what's going on for them. And so there's a lot of different options there that sometimes we pull out. And I kind of blend and mix and match these, occasionally for an individual and what they're willing and able to do with their lifestyle and their job and all of that. So you don't have to do them 100%. Sometimes you can modify these for different things. So these are all providers, and this is not everything. There's other providers also that can be certified in functional medicine. Basically, you have to be licensed in a healthcare field. So you're going to see MDs, DOs, NDs, naturopathic doctors, acupuncturists, chiropractors, physician assistants, nurse practitioners, nutritionists and dietitians, professional counselors and psychologists, dentists, physical therapists. So there's a lot of providers that can be certified in functional medicine, and then we use that within our scope of practice, right? So if you're trying to figure out what sort of functional medicine provider to go to, I usually, when people reach out and ask, if you've got medical problems going on and there's surgeries being recommended and you're on a lot of medications, I would usually suggest finding an MD or a DO if possible, because they're going to be trained in the surgeries that are being prescribed and be able to say like, oh, it's a terrible idea and be pretty blunt about it and tell you what else they can do, or say, yeah, I think that's probably medically necessary, but we can also work on the root cause. So you'll get that kind of combined answer. Other people find that they can work with an ND and their MD as long as their MD says, yeah, I don't know about that part, but I'm glad you're doing that part. And then your other providers working on the functional part, that there can be that integrative approach if both providers are sort of in communication and working with each other. Naturopaths would again be like what I just mentioned. They'd have more knowledge of medications and surgeries and things like that and be able to give a little more input on that disease process and what to do on the alternative side. They're going to be a little more careful, I would say, depending on state regulations about making any sort of broad statements about your medical, like your medical prescriptions and things like that, because that could be a conflict for them possibly. But I think they'll have more knowledge and be able to kind of talk to you about that a little bit better. Acupuncturists, obviously, going to be, great if there's like chronic pain and wanting to use a lot of herbs, won't have so much the medical side of knowledge. This would be true with acupuncturists and nutritionists, like that there's going to be more of just kind of depends what approach you want. If you want acupuncture and Chinese medicine as part of that approach, then an acupuncturist would be a good option. Chiropractors, obviously, if you're already going to get adjustments and you're getting some of that like spinal care, and then you want that functional side. A physician's assistant will be able to prescribe medications, so that's going to be up there with the MD/DO of having that medical side knowledge. Same with nurse practitioners. Dietitians and nutritionists, so we focus a lot on the food part And so if you need a lot of help with diet and lifestyle, you get more of that coaching side of how to make those adjustments, how to change, like working with food sensitivities. So if the diet and lifestyle piece is a big one, then probably counselors, dietitians, or nutritionists are going to be able to fill that gap, whereas the MDDO don't do as much of that stuff, but they'll give you the medical knowledge side. Counselors, obviously, if there is like emotional stuff going on also, or nervous system dysregulation, along with, wanting to get some functional medicine work done, they're going to focus more on that side. And then there may be, it depends on the state and the licensure as to which providers can get labs or not. Most of us can get them in Kansas and Missouri. I know I have a supervisor too that allows me to get a little bit more. So that's just a question that as you're looking at people, you would want to ask. Let's see. So if you're, I think I mentioned this, but with food plans, this is a common thing we wonder is like, well, what should I eat? Some people say Mediterranean diet. Some people say, if I've got gut issues, I should do low FODMAP or I should do paleo. There's keto. And so largely in functional medicine, we're choosing this based on labs or based on root causes or an already diagnosed disease that gives us a pretty good idea of what's happening as a root cause. Diabetes is a good example. We kind of know there's insulin resistance. We suspect there might be stuff going on in the gut and that blood sugar is dysregulated. And that can help guide towards what food plan to do. Sometimes we really need to see some labs to have a better idea of what's going to be most helpful. And then from there, we try it out and we see how we do and we tweak it and we adjust it and we find what also is intuitive to that individual and feels the best and seems to be helping the most. It's based on labs, but also based on personal choices, based on the environment, like who are you eating with, cooking for, family, a single person. That's all going to impact what is doable, budget, and lifestyle. How much time do we have to cook or prepare? So I just threw this in. If you're, asking and looking for a functional medicine provider, is to just ask where they've been trained and where they've been certified. IFM.org, the Institute for Functional Medicine, is the gold standard. And so you're getting a well-trained person if they've been trained there. But that doesn't mean that these other programs aren't great. Chris Kresser has a program called the ADAPT program that's very good. Dr. Kalish, Dan Kalish has a program. He's been around for a really long time, almost longer than IFM maybe. And he has a program. And then the mindfulness medicine certification program was the first one I went through. And they are a naturopathic doctor and a doctor of Chinese medicine. And they do a lot of like mindfulness and meditation also. So that I liked it. I did that initially because of that component. And then I also went through IFM as well later. So those are some programs. They may not be the only ones out there, but they're the main ones I'm aware of. And always just asking how someone's trained is a good idea. I think I talked through this, what do you need the most help with? And that's how it can help guide you towards what sort of licensed provider you might be looking for. Typically, when you start a functional medicine process, there will be an initial case review session to really kind of go over previous labs, to go over what you're eating, what your lifestyle looks like, symptoms, what's happening, all of that stuff. Then there's labs that get ordered at that appointment. And then there may be an appointment set up to start working on diet and lifestyle adjustments. And some people will start like with an elimination plan or some sort of reset if it's a longer 3 or 6 month program to just kind of identify what foods are we eating that are a problem up front and get on really healthy foods at the get-go. There may be counseling or coaching session to work on lifestyle or stress. And then there's a lab review appointment. And at that appointment, typically then lifestyle, diet, supplements are adjusted and laid out. And then there may be, and this is all need-based, that may be it. And that's kind of what you do for a while, or some people are coming regularly to do coaching or counseling, or lab follow-up and review may happen every 1 to 2 months for a while, or it can be longer in between appointments. So it just depends on the provider and also on the individual needs. All right, I got going a little faster there in those last few slides because I could see we were getting to the end of our time. So I just want to make sure we had a few minutes for questions if anybody has any. I see what you said, Kim. Stress and poor diet. Yeah, it can do a lot, huh? And it's easy to do in our modern society. There's not great food around and fast-paced life.
And Brooke, I don't have a question, but my husband gave me permission to share his story, how we came about functional medicine, if I may.
Yeah, please.
So, about 5 or 6 years ago, my husband went for a routine eye exam, and the doctor said, "Oh, you have bleeding in the eye." So he sent him to a better eye specialist who treated his eye and double checked, and a couple more appointments. Everything was fine, and he sent him his merry way. He just treated the eye. But he should have told him, how we found 5 years later on this journey to figure out what is wrong with him. He said bleeding in the eye means you have internal bleeding someplace else. It's just not bleeding in the eye. There is something going on inside. So he should have sent him to hepatologist or having his esophagus checked, which eventually he did. They found out he has esophageal bleeding. So it took many years to put it all to kind of get it like retracted back to normal health. So this is, I guess, the Western medicine, they just looked at the eye. But if he went to somebody who kind of treats the whole body, they would have like, what else is going on here? You just don't get a random bleeding in the eye.
Yeah. Wow. Good for you for digging.
Thank you.
Yeah. I see a question in here from Lisa. What do you recommend for help with allergies and getting off traditional medicine inhaler? So there's on root cause, usually with allergies, there's 70% of our immune system is in our gut. So I always wonder about gut health and want to work on that. And I do think that, because knowing you, Lisa, like this isn't a new area that you've been working on. That there's something called a 5R program for gut repair. And a lot of times I think we don't spend enough time with reinoculation and repair. So we remove, we replace, and then we start reinoculating. And sometimes we just don't do enough, because I think in general practitioners haven't done enough in that area. I don't think I did for a while. And I'm really focusing when I'm working on gut health on making sure people don't disappear. Part of it is because sometimes we do 1 or 2 appointments, we feel a little better, then we disappear, and a year later we still have some of the stuff going on, right? And that reinoculation and repair can take a lifetime, but definitely 6 to 12 months of like focused work. And then getting in the habit of having a lot more certain strains of bacteria through, homemade yogurts or things like that. It can take a little bit of effort to really get that going. So that would be one area. And then I think, there's definitely a use for, like, if you have a good aromatherapist, using like essential oils and things like that for breathing to help with that. There is a company, see if I can think of it real quick. But there's a local guy who makes oils. He's really good. He's got very good oils, and it is Restore Hope Oils, I believe. Restore Hope Oils. So I would recommend them. I've gotten some that helped my daughter with her asthma situation that we're working on. So that's been good.
And Brooke, there was a question about 23andMe, if it discovers the MTHFR mutation.
Yeah, so you'll have the data that you need to know if that's there, but then you have to have that interpreted through a software. And what I would suggest is if you haven't ever gotten your genetics, do it through Strategene, because they will put it through that software for you. If you've already gotten 23andMe, then I'll have to follow up. Like, you can reach out to me if you want. Here's my contact info here. But you
And
can
if
reach
I
out.
may chime in again, I did 23andMe and then I did the real DNA, and it's a comprehensive report, and it's done by people who done many years of studying. And what I, for example, discovered, which was good to know, my body doesn't process doesn't process vitamin A. So I could eat 5 pounds of carrots a day and I still have deficient vitamin A, which I could have macular degeneration and blindness or whatever. So, or it kind of tells you how your body functions on many levels. Like if you take a supplement and wasting money on it because you don't need it, or which supplements you really do need, or which foods to eat instead of supplements. So that's kind of my experience with the medical DNA.
Cool. Yeah. Yeah, those are really neat. And there's micronutrient panels too for micronutrients
Yep,
to
yep,
look at.
yep.
Yeah. Uh, let's see. What else? Any other questions? You can see here if you need to reach out or if there's any follow-up questions, feel free to email me. Um, as I mentioned, I always do a 20-minute complimentary consult if you're interested. If you're looking for a provider and you want to chat, I'm happy to do that. So you can always book that on my website.
Well, thank you very much, Brooke. It's 1 o'clock. Thank you so much for your time.